Assalamualaikum Miss, how are you today? I hope you are in a good health. I am Atika, a third year dental student, and in today's oral hygiene instruction session, I will be explaining about what periodontal health is and also about your current gum condition based on our previous examination, and we'll take a look how we can manage it together. So first, I would like to explain to you what structures that supports your tooth. So your tooth are not just standing on their own. They are held in place by a group of tissues called the periodontium. The periodontium includes the gums, the bone around the tooth, and the tissue that help to hold the tooth firmly in place. Now, let's compare between healthy periodontium and unhealthy periodontium. When the periodontium is healthy, it keeps your teeth strong and stable. But when these structures are disrupted, it may lead to deepening of pocket, inflammation of the gums, which is known as periodontal disease. So now I will explain to you what is periodontal disease and the stages. So periodontal disease is a chronic bacterial infection of the gum and the bone supporting the tooth. So first, we will start with healthy gum. A healthy gum are usually pink in color, firm, and they do not bleed when brushing or eating, and they fit tightly around the teeth. In the early stage of periodontal disease, this is called gingivitis, where the gums become red, swollen, and bleed easily. This stage is still reversible with proper brushing and cleaning between the teeth. However, if gingivitis is not treated, it can progress to periodontitis. This can cause deep gum pockets and beginning of bone loss. At this stage, it can't be fully reversed, but it can be controlled. In advanced periodontitis stage, more bone is lost around the teeth, which causes the tooth to become loose or shift position. And without treatment, tooth may need to be removed. So, periodontal disease usually develops slowly and may not cause pain in the early stages. This is why many patients do not realize that they have gum disease until it becomes more serious. And based on your dental examination, we observe plaque and tartar build up, bleeding gums, and deep pockets around some of your teeth. And from your X-ray, we also can see some bone loss around the teeth that was extracted, which causes the teeth to lose its support. So that's why it need to be removed. So these conditions are called periodontitis. But don't worry, the good news is your diabetes is well controlled and you are a non-smoker, which is good as we can see from your previous extraction, where your wound heals without any complication, and your condition can still be controlled with proper periodontal treatment and good oral hygiene at home. Okay, now let's move on to the importance of plaque control. Okay, before that, what is dental plaque? Dental plaque is a soft, sticky layer made up of bacteria. It forms on the tooth surface every day, even after brushing. If plaque is not removed, the bacteria can irritate the gums. As a result, the gums may become red, swollen, and bleed easily, especially during brushing. This is the body's natural response to the bacteria. When this inflammation continues for a long time, it can damage the tissues that hold the teeth in place. The gums may start to pull away from the teeth, creating deeper spaces where more bacteria can collect. Over time, the infection can also affect the bone supporting the teeth, leading to an unhealthy periodontium. If plaque is removed early, the gums can return to a healthy condition. However, if plaque is not removed properly, it can harden into tartar, or also known as calculus. This is calculus. So, tartar cannot be removed by brushing alone and requires professional cleaning such as scaling or root debridement. That's why plaque control is important because it prevents gum inflammation, gum disease, and tooth loss. Removing plaque daily helps to keep the gums healthy and prevents further damage to the supporting tissues of the teeth. So, to control plaque effectively, we use different oral hygiene aids such as toothbrush, fluoridated toothpaste, dental floss, interdental brushes, or sometimes mouthwash if prescribed. So each aid cleans different areas of the mouth and works best when used together. Okay, now I will explain and demo to you the correct technique to brush your teeth. So, you should brush your teeth twice a day using a soft bristle toothbrush and a fluoridated toothpaste. So, the recommended technique is called the modified best technique, which where we angle the toothbrush 45 degrees towards the gum line, like this. Okay, then we gently move it in a circular motion, then we swipe it. Angle it, then brush, circular movement and swipe it. Same goes to the upper teeth. Just angle it, make sure the bristle touch both of the teeth and also the gum. Then angle, circular movement and swipe. Okay. As for the front teeth, okay, you place your toothbrush vertically and then just swipe it like this. Okay. And as for the back teeth, make sure the bristle can reach the fissures and the pits of the biting surface. Just move it back and forth like this. Okay, so next, this is a single tufted toothbrush. So as you can see, because it is small, it allows us to clean the areas that a normal toothbrush cannot reach, such as at a crowded teeth or near the wisdom teeth. So to use it, you just place the bristle at the gum line. Place the bristle at the gum line and use a small circular motion to remove the plaque like this. It is, or you can also use it if you have any missing tooth. Then you just clean at the missing tooth area like this. Or if you have any furcation, so you can clean that area using this toothbrush. Okay, now I would like to explain how to clean between the teeth, because brushing alone is not enough. Your toothbrush only cleans the front, the back and the biting surface, but it cannot clean the tight spaces between the teeth where the plaque collects. So, for people with healthy gum, the gums are usually tight and fit closely around the teeth. So, since the spaces are small, dental floss is enough to clean those areas from plaque. So, for people with healthy gums, flossing once a day is usually sufficient. So, I'm going to show you the correct way to use floss. First, take out a sufficient amount of floss and then wrap it around your middle finger, left and right. Then leave it about 2 to 3 cm or 3 to 5 cm in between your fingers, and then just gently guide it into the in between two teeth using a back and forth motion. back and forth motion until it reach in between your teeth. But don't snap it down like this because it can hurt your gum. Don't just simply pump like this. Okay, use back and forth motion, and once it is between your teeth, curve it into a C shape and slide it up and down, and also below, also near the gum line, so that it can remove all the food or plug that is trapped there. Up and down, out. Okay, don't forget to clean the tooth next to that tooth, like this. Out. Okay, then or to make it easier, you can also use this floss holder, and it's also the same way. Just to put it in, you must use a back and forth motion like this, back and forth motion, and once it is in, make a up and down motion and out, up and down and out. Also, don't forget to reach at the gum line also, to make sure all the plug is removed. Okay, however, for a patient with gum disease, the situation is a bit different, because when the gums are infected, they can become swollen and may slowly move away from the teeth, which creates bigger gaps between the teeth and the gum, or also known as gum pocket. So in these bigger spaces, floss alone may not clean properly because it is too thin and does not fill the space. That is why patient with gum disease, we usually recommend using interdental brushes like this. This is interdental brushes. So it is designed to fit between the teeth, and because it fills the space better, it can clean the sides of the teeth and under the gums effectively, which will help to remove bacteria and keeps the gum healthy. So to use the interdental brush, choose a size that fits comfortably between your teeth. If your space is big, so choose a bigger size. But if the space is just small, then just choose a small interdental brush. Then you gently insert the brush between the teeth and move it in and out a few times, like this. But okay, you don't have to force it because it should not be painful, and you can do this once a day. If the spaces are too tight, you can use dental floss too. So for patients with gum disease, we often recommend using both dental floss and also interdental brush, depending on the space. So cleaning in between your teeth is very important because those plaque and bacteria likes to sit there, likes to hide in this area. So by cleaning properly between your teeth every day, we can reduce gum infection and prevent the condition from getting worse. Next, you can also clean your tongue using a tongue scraper or toothbrush. This will help to reduce bacteria and improve your oral hygiene and your breath. Just scrape it up. Imagine there's tongue here, so you just scrape it up. Scrape. Okay. Next, mouthwash. Mouthwash may be prescribed to help reduce bacteria. However, this is only an adjunct and does not replace brushing and interdental cleaning. You also can use mouthwash if you want, and please use it in correct amount, which is 10 to 15 ml. Just gargle it and spit it out. and it is recommended to use 30 minutes after brushing. Now, let's discover the periodontal treatments that can be done. I'm going to show you some video so that you can see the procedure clearly. So, before treatment, we may perform plaque scoring, where we will apply a disclosing gel on your teeth. And after finish applying, we will ask you to rinse it gently and we'll observe the stain that remains on your teeth, which indicates the presence of plaque. This will help us to identify areas where plaque is still present and allows us to monitor your oral hygiene improvement. Next is scaling. So, scaling removes hard deposits called calculus or tartar from above and below the gum line. This will help to reduce gum inflammation and allows the gum to heal. Next video is about root debridement. Root debridement is done to smoothen the root surfaces of the teeth so that bacteria cannot easily stick again, which will improve the gum attachment. After completing periodontal treatment, you should regularly do follow-up visits so that we can monitor your gum health and prevent the disease from recurring. And to summarize, periodontitis can be controlled with proper periodontal treatment and good oral hygiene at home. By brushing correctly, cleaning between your teeth daily, and attending regular dental visits, we can maintain your gum health. Do you have any question, Miss? No? Okay, that's all for our session today. Thank you for your time.